Hello and welcome back to the Bearded Dentist. Today we will be doing a cervical cavity fill. Cervical cavities are where the gum line meets the tooth, and as you're about to see, sometimes what can look like a small black spot on a tooth can turn into a very large filling, as we need to remove all of the white chalkiness that's around the edge of the tooth, and you will see that what's underneath that black stuff really opens up into the tooth there, and we have to remove a lot of structure. Anything that's not perfectly healthy tooth has to go. This patient was not numb all the way. Sometimes there is a buccal nerve there on the side of the tooth that likes to help out, likes to give the tooth a little bit of feeling. Sometimes it is a little higher on patients than others. So a inferior alveolar block does not reach the buccal side or the cheek side of the tooth. I like to get a really good blanch. Now, you have to be careful. If you see a line blanch instead of a space, so if you see as soon as you press it in, if you see a big line going across the sides of the teeth there, blanch immediately, stop. Because what you're doing is you're putting it directly into some vein or artery, and you're going to collapse that vein or artery, and it's going to hurt a lot. And it's also not going to get the patient numb because you're not putting it in the tissue. And then here I'm doing a little bit on right next to that premolar we're about to do. So I always take the slow speed to these because you would be amazed at how much soft tissue, soft tooth structure is underneath these. You really want to get all of that kind of leathery, cheesy looking substance out of there. This is my favorite thing to do in dentistry, is bust out the slow speed and kind of get this stuff out. I also like slow speeds because most of the time they're either stainless steel or carbide. These are stainless steel, and they're very nice to the gum tissue. Now, the gum tissue along this tooth was angry anyways because of the cavity that was there, so there's going to be bleeding. So you can't avoid it. It's better to be aggressive and remove as much or all of the cavity as possible, and anger the gums a little bit. We'll be able to take care of that. So we're going to rinse all that away. We're going to move on to the premolar. We're not done with that molar yet, but we're going to move on to the premolar here. Again, a little tiny black spot turns into a very large piece of the tooth. I always tell patients these are my least favorite fillings to do because they're very hard to isolate. I really honestly cannot 100% isolate them. There's going to be fluids in the crevice between the tooth and the gum that are always going to be there. They're impossible to keep at bay while we're doing the filling. So these fillings really, honestly, they don't last the longest. Even if you do a really good job and isolate as much as you can, you would be lucky to get a good 5 to 7 years out of these, which personally I don't, I like longevity I like at least 10 years out of anything I'm doing, but neither of these teeth were big enough that they would need a crown, and I don't like crowning otherwise healthy teeth if we can, isolate these areas and treat them. But I will say, for any young dentists there or dentists that, see abfraction lesions or anything like that and are very quick to want to go fill those, I'm very weary against that because most of the time an abfraction lesion is not going to be fixed with a filling. All you're doing is destroying the enamel, removing enamel and dentin, and you're just putting something there that can then leak and get a cavity. So I'm really picky on which one of these that I'll do. They have to have a cavity, obviously, like this one. Active caries needs to be present for me to want to do this. As you can see, the molar behind this molar has a huge cervical lesion. That tooth is slated for a crown. This patient just had a whole bridge done, which will be in another video, and kind of wanted to put his money into getting these fillings done before we got to that back tooth there, and that's okay. We'll get to it in time. So again, the gum tissue is going to be real angry, but see how much of that tooth I had to remove. I basically had to girdle the outside of that tooth because all of that was unhealthy tooth structure there. So we remove that, we etch it, Get all of that etch out of there. And then as I switch my light, you'll see a color change here. And that little yellow area is not yellow anymore. And I know in the previous shots it kind of looked like there was some cavity left. Trust me, there was not. Now, when you have areas that just won't stop bleeding, the best thing to do is time and pressure. Push on it with a quick stat, or even you can use a cotton roll sometimes if it's right on the edge there. But just like making diamonds, the best way to stop bleeding is time and pressure. And if you got to hold it for 30 seconds, so be it. But I always make sure these are dry as I can get them, and zero bleeding. Absolutely no blood can enter this field, or it's going to completely ruin the filling that you're trying to do. That bond is not going to take, and it's going to leak immediately, and you're going to run into problems. With these, I always overfill. I press it, I push the gum tissue out of the way with the filling material. Again, there's going to be crevicular fluids that are going to get in there. There's no stopping that. But that's why I do like to push them out of the way with excess material that I'm just going to remove. So if there is a little bit of crevicular fluid getting up in there, hopefully, ideally, that is prepped out, and then we have a nice clean area to work with. And I always like to use the flat on these and really, really press, like you'll see here, press that down into that area. And you'll see how we remove that with the burr later. And then we cure that, and I always suggest keeping the curing light, not touching the tooth, not because I care about getting the curing light dirty or whatever. Those things get super duper hot. You can cause a lot of sensitivity, and you can harm the tooth and harm the nerve, and it's just best not to do that. And sometimes if you're doing things and patients aren't numb and you're just doing a little cure, they will tell you, because those things get really, really hot, especially the good lights. So here we're working on the premolar, adding some bond there, air drying, curing, and then again, way overfilling here. Pressing that, you can see the blanching tissue there. That's what we like to see. Pushing it way up into all the way down, all the way up, so we don't have any voids. That's another thing with these. If you have any type of void or any type of area that you missed, there's going to be sensitivity. This is a super sensitive part of the tooth, and so you always want to make sure you press it in there. Then I like to take a red diamond, a thicker red diamond here, to remove the bulk of it, following the contour of the tooth. Very, very important, you do not let these get overly bulky. If you leave a lot of contour, a lot of heavy convexity to the buccal part of the tooth, then it's going to just trap debris and plaque, and it's going to be very hard for the patient to keep clean. And I get as close as I can to the gum tissue without really getting into it, because I will definitely get into it with the next burr that we use. A little bit blurry here, but still showing that, following that contour of the tooth, getting as much of that bulk material out of the way. If you go right to the needle point burr, which I'm about to use, if you use that right away, you're going to get a lot of digs and ditches into your filling. So with this burr, and this is what a cosmetic dentist taught me in school, you want to get that thing under the gum tissue. You want to, don't be afraid of hurting that gum. The gum tissue is already angry. It's already going to bleed. It's already damaged from the filling being there. It will heal itself. It will be fine. The worst thing a dentist can do is leave an overhang in this area. You are just going to piss the gums off even more. You're going to have a lot of stuff get caught in there, and your filling is going to fail almost immediately. What you saw that I just did is I like to grab a little bit of the blood on the tip of the burr and paint the tooth with it. What that blood will do is show me if there's any areas of flash or overhang or anything that I need to get rid of. And then I take the tip of the burr going at a 90 degree and see where there's a ledge. If there's any ledges, like there was right there, I hit it again. And I do this over and over until there are no ledges. Absolutely zero ledges is the best way to make these fillings last. And yeah, you're going to get a little bit of cementum. You're going to remove a little bit of that off the edge of the root, and that's okay. Just think of it as a really nice fast scaling. Don't be afraid to get in there, get in between the gum and the tooth. Trust me, the little bit of angry gum tissue you're going to have here is well worth it when you don't have any overhang or any debris or anything causing serious problems in the very near future, because it will. So yeah, that's my quick little video on removing that decay on the cervical margin, how to fill it, and how to make sure your filling will last as long as possible. Here's the final product there. Definitely looking a lot better. Gums are angry, but again, those will heal. Hey guys, thanks for watching. I really appreciate everyone that likes and subscribes. And if you like these videos and you're a dental student or a dentist and you find them useful, then please comment, let me know, and show your friends, your dental buddies, and see if we can grow the channel. Thank you so much. Have a great day.